Everyone, we're here at the inaugural Sandbox Conference here in the Microsoft headquarters in Toronto, Ontario, and we're about to present on the Institute of Families and about the recent research report that's come out from last May 7th event on child and youth mental health. So we're really excited to get going and hope you enjoy it.
Can everybody hear me? Yeah. Stop my nose. So, hello everybody. As Kelly mentioned, I'm the youth director of the Institute of Families. I'm honored to be in that position. I'm also a founder and president of Students for Mental Wellness, which is a local nonprofit based out of Vancouver. We started originally out of SFU, a school. I'd just like to share a little bit about my background, why I'm here, why I got involved, a little bit about my history. So the last 10 years of my life has really been like a roller coaster ride. Ups, downs, new directions, no directions. It started in high school, you know, happy kid growing up, playing lots of sports, did okay academically, didn't have to try too hard, got by, ended up after high school playing junior A hockey, and that's when, you know, some things started to develop mentally, well, lack of development, I guess you could call it, and I just didn't know what I was doing, where it was all going. So I moved to Whistler. I stopped playing hockey. I said, I just want some freedom in my life. Moved to Whistler, started snowboarding and working up there full time. And after 2 years of making $8 an hour, and my parents, encouraging me to go to post-secondary education, I ended up enrolling in UNBC up in Prince George. I thought this is going to be my new beginning. This is going to be a new start, a new direction for me. Well, I got into the same crowds, partying, drinking, recreational drug use, and it just wasn't going anywhere. I realized I had to make some significant changes in my life to make progress, to keep moving forward, to keep learning, to keep growing. So what did I do? I had no idea what to do. I started seeing a psychologist. I just isolated myself from my friends, read books. I talked to my family on the phone every day, just struggling to get by. But I had a goal, a dream to get into either SFU or UBC business program, which I worked towards. I just focused on that. Later on in the year, about a year later, I did get into SFU, and I thought, okay, this is going to be my new beginning. I'm going to meet new people, I'm going to get engaged in new things. So I started volunteering, I started signing up for everything, and that's when it all crashed. It came tumbling down. I had my first episode of psychosis, and had to drop out of school, move home. I had no supports, no friends I could talk to about this. I didn't know what to say. I didn't understand what was going on. But I was one of those 1 out of 5 that Kelly mentioned that did get support. I got entered into the EPI program, the Early Psychosis Intervention Program in Fraser Health. Got help. I recovered well. And I got back to volunteering and working and my studies and living on campus. But I started piling on too many things that I didn't understand stress management and relapse prevention techniques at that time. So I had a relapse while I was in Texas visiting my sister, and I attempted suicide. And it was the toughest thing I've ever been through. It was the scariest time of my life. I eventually made it back a couple days later. Actually, it was the same day I attempted suicide. I flew back to Vancouver. Because hospital bill in the States, I think the assessment was going to cost $3,000 alone for an assessment. Hospital time, I would have been hospitalized. How much would that cost? So I got back to Vancouver, entered into hospital, psych ward, and that's when I got diagnosed with schizophrenia. And that's when I really hit me. I said, I have to focus on my mental health. I have to learn how to cope with this, how to manage my stress. All the relapse prevention techniques I can. That's when things started to turn around. And in this dark moment of my life, I said, if I ever get better, because I thought my life was over. I thought I was going to be like that the rest of my life. Delusions, hallucinations, thinking people were out to get me. I said, if I ever get better, I'm going to do something to give back to the mental health community that had really given me so much. My great mental health team, supports from psychiatrists to social workers, family therapists to everyday mentors like Kelly and people I've met along the way. So I found a new direction in my life. I found mental health I was passionate about, I was interested in. I got involved, I started volunteering. I also started hiking and getting outdoors, which is another passion I developed. I met Val, my girlfriend, who you see here, on a snowshoe trip, organized by the Outdoors Club at SFU. I started public speaking, met Kelly at an event. And I formed SMW, Students for Mental Wellness, and just started getting involved, seeing how I could help. I joined the Institute of Families because I believed in Kelly. I believed what she'd done. I believed in the way she develops relationships with people, and I believed we could make a difference. I saw the need to unite families in the movement. I saw the connections being made and the relationships being formed, and I saw the possibilities. As for me, I just kept following my passions. Mental health work with the Institute of Families now, and Students for Mental Wellness, and a number of other committees and public speaking engagements. I started running, hiking, biking, climbing my way up my list of adventure goals for the year. Living my life as I hoped I would one day just after my diagnosis. In October of this last year, 2010, I was valedictorian for my class of business students at SFU. Today I success. Today I celebrate every success. So now I'm going to talk a little bit about the IF, what the components are, what we're doing, what we're planning. We're creating videos and manuals to help develop provincial family councils in every province of the country. And I'm working on that with another youth on the council. We're supporting building awareness and uptake for the National Child and Youth Mental Health Day, which is May 7th in BC and a couple other provinces, I believe. And we're trying to develop Family Smart. And I have a little story about what I would call family dumb. It was when I was admitted to the hospital. And as I said, I just survived a suicide attempt. I was completely suicidal, psychotic, I had delusions, as I mentioned. And so my family took me to the hospital, and we had an intake worker meet with our whole family, and at the end of that discussion he said, "Brent, I think I'm going to keep you in the hospital for the night." I said, no, I don't think I have to stay here. I'm fine. And he said, "No, we're keeping you here." And so what happened, he took me from my family. He said, "Go in here, change into these clothes," took my clothes away. My family had to go home. They took me, a security guard, not even a mental health worker, a security guard took me in an underground tunnel to the psych ward. I had no idea where we were going, no idea what was going on. I was scared out of my mind. And while in the hospital, I was asked to fill out a form, signing away my assets just in case I died there. That's what I call family dumb. So, what if the hospital intake was Family Smart? What if they explained why I was admitted and what was going to happen next? What if my family was taken with me to settle in so I could get comfortable in my settings? What if the psych ward wasn't such a depressing setting? What if it was, I've been to the spa a couple times. You know how relaxing it is? A peaceful setting. Why can't a psych ward be like that? So I have a vision of a family going through what my family went through 4 years ago. And the services and supports, facilities and functions, connections and cooperation, being light years ahead of what it was then. Family Smart. This is what's possible through the IF. This is why I'm here. Thank you.